Cancer is a word that evokes fear and uncertainty. It's a disease characterized by the uncontrolled growth and spread of abnormal cells. While often associated with organs like the lungs or breasts, cancer can also affect our bones. This is known as bone cancer. Bone cancer is a relatively rare type of cancer. It occurs when abnormal cells begin to grow uncontrollably within the bone tissue. These cancerous cells can weaken the bone, leading to pain, fractures, and other complications. Understanding bone cancer is the first step towards fighting it. Knowledge empowers patients and their families to make informed decisions about their health. While a diagnosis of bone cancer can be daunting, it's important to remember that advancements in treatment have significantly improved outcomes for many patients. This essay will guide you through the basics of bone cancer, from its types and causes to diagnosis and treatment options. We'll also explore the importance of support systems and the latest advancements in research that offer hope for the future. Bone cancer is not a single disease, but rather a group of cancers that affect the bones. Each type originates from different cells within the bone tissue and behaves differently. The most common types of bone cancer are osteosarcoma, chondrosarcoma, and Ewing sarcoma. Osteosarcoma is the most prevalent type of bone cancer, primarily affecting children and adolescents. It typically arises in the long bones of the arms and legs, particularly around the knee joint. Chondrosarcoma, on the other hand, is more common in adults and often develops in the pelvis, hips and shoulders. It originates from cartilage cells, which are responsible for cushioning the joints. Ewing sarcoma is a rare and aggressive type of bone cancer that primarily affects children and young adults. It can occur in any bone, but is often found in the long bones of the legs, arms, pelvis, or chest. Each type of bone cancer requires a tailored treatment approach based on its specific characteristics and the patient's overall health. Early detection of bone cancer is crucial for successful treatment. However, the signs and symptoms can be subtle and easily mistaken for other conditions, such as sports injuries or growing pains. It's essential to be aware of these symptoms and seek medical attention if they persist or worsen. The most common symptom of bone cancer is persistent pain in the affected bone. This pain may be dull and aching at first, gradually increasing in intensity and becoming more constant over time. Other symptoms include swelling around the affected area, tenderness to touch, and limited range of motion in nearby joints. In some cases, bone cancer can weaken the bone, making it more susceptible to fractures. Unexplained fractures, especially after minor injuries, should always be investigated. Additionally, fatigue, weight loss, and anemia, which is a low red blood cell count, can be general symptoms associated with cancer. If you experience any of these symptoms, it's important to consult a healthcare professional for a thorough evaluation. While the exact causes of bone cancer remain largely unknown, several risk factors have been identified that can increase an individual's likelihood of developing the disease. These risk factors can be broadly categorized into genetic and environmental factors. Genetic predisposition plays a significant role in some cases of bone cancer. Certain inherited genetic syndromes, such as Li-Fraumeni syndrome and retinoblastoma, can increase the risk of developing various types of cancer, including bone cancer. Additionally, individuals with a family history of bone cancer may have an elevated risk. Environmental factors such as exposure to radiation have also been linked to bone cancer. Previous radiation therapy, particularly at a young age, can increase the risk of developing bone cancer later in life. Other potential risk factors include certain bone diseases, such as Paget's disease of bone, and previous injuries to the bone. Section 5. Staging the cancer from early to advanced stages. Once bone cancer is diagnosed, the next step is to determine the stage of the disease. Staging helps doctors understand the extent of the cancer's spread and develop an appropriate treatment plan. The staging system for bone cancer typically ranges from stage 1 to stage 4. Stage 1 bone cancer is considered localized, meaning the cancer is confined to the original tumor site and has not spread to other parts of the body. As the cancer progresses, it may invade surrounding tissues and lymph nodes, indicating a higher stage. Stage 4 bone cancer is the most advanced stage, indicating that the cancer has spread to distant organs, such as the lungs or liver. This is known as metastasis. The stage of bone cancer is a crucial factor in determining the prognosis and treatment options. Diagnosis, unveiling the truth through imaging and biopsies. Diagnosing bone cancer typically involves a combination of medical history review, physical examination, imaging tests, and biopsy. Imaging tests such as X-rays, kinetic scans, and MRI scans provide detailed images of the bones and surrounding tissues, helping doctors visualize the tumor and assess its size and location. A biopsy is a procedure in which a small sample of the tumor is removed and examined under a microscope to confirm the diagnosis and determine the specific type of bone cancer. This is usually done under local or general anesthesia. Blood tests may also be conducted to assess overall health, liver and kidney function, and blood cell counts. Once the diagnosis is confirmed and the stage is determined, a multidisciplinary team of specialists, including oncologists, surgeons and radiation oncologists, will work together to develop an individualized treatment plan tailored to the patient's specific needs and goals. Section 7. Treatment options, a multidisciplinary approach. Treatment for bone cancer involves surgery, chemotherapy and radiation therapy. The approach depends on the type and stage of cancer and the patient's health. Surgery aims to remove the tumor and affected tissue, and limb-sparing surgery may replace the bone with a prosthesis. In advanced cases, amputation may be necessary. Chemotherapy kills cancer cells throughout the body. Radiation therapy targets and destroys cancer cells in a specific area. Section 8. Complementary therapies supporting your well-being. While conventional treatments like surgery, chemotherapy and radiation therapy form the cornerstone of bone cancer treatment, complementary therapies can play a supportive role in managing symptoms, improving quality of life, and promoting overall well-being. These therapies are not meant to replace conventional treatments, but rather to complement them. Acupuncture, a traditional Chinese medicine technique, involves inserting thin needles into specific points on the body to stimulate energy flow and promote healing. It has been found to help relieve pain, reduce nausea and vomiting associated with chemotherapy, and improve sleep quality. Yoga, an ancient practice that combines physical postures, breathing exercises, and meditation, can be beneficial for both the body and mind. It can help improve flexibility, strength and balance, as well as reduce stress, anxiety and fatigue. Section 9. The importance of support and information. A diagnosis of bone cancer can be overwhelming for both patients and their loved ones. It's essential to have a strong support system in place to provide emotional, practical and informational support throughout the journey. Talking to family and friends about your diagnosis and treatment can help them understand what you're going through and how they can best support you. Joining a support group, either online or in person, can connect you with others who are facing similar challenges and provide a safe space to share experiences and coping strategies. Staying informed about your diagnosis, treatment options, and potential side effects is crucial for making informed decisions about your care. Don't hesitate to ask your healthcare team any questions you may have, and seek out reliable sources of information, such as reputable cancer organizations and websites. Section 10. A brighter future. Advancements in bone cancer treatment. The field of cancer research is constantly evolving, and significant advancements have been made in the treatment of bone cancer in recent years. These advancements offer new hope for patients and their families. Targeted therapy is a promising new approach that uses drugs to specifically target cancer cells while sparing healthy cells. This can help reduce side effects and improve treatment outcomes. Immunotherapy is another area of active research, which aims to boost the body's own immune system to fight cancer cells more effectively. Clinical trials are essential for testing the safety and effectiveness of new treatments. Participating in a clinical trial can give patients access to cutting-edge therapies and contribute to the advancement of bone cancer research. By staying informed about the latest research and treatment options, patients can work with their healthcare team to make the best decisions for their individual needs.